This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Hello, ladies and gentlemen. This is Dr. Famuyiwa with another episode of Fertile Talks. And today we have something very unique. We have a special guest, Dr. Anna Sattah. She is a functional medicine specialist. She transitioned from being an ICU doctor to a functional medicine specialist. Now, what does this functional medicine specialist do? I'll let her introduce herself. But a lot of what she does has application for our fertility patients who are facing chronic inflammation that may be compromising their chances for fertility. So welcome to Fertile Talks, Dr. Sattah. I'm going to like you to tell us a little bit about yourself.
Yeah, thanks for having me. It's really good to be here. So I'm Anna Sattah, and my background is in conventional medicine. I actually trained in general surgery, and then I did a fellowship in critical care. And then I practiced as a full-time ICU doctor for about 8 years. And that included all through the pandemic. And it was always waiting until people were really, really sick. And then we were trying to intervene at the very end stages. And during the pandemic, it was just very clear that we didn't have a lot of good treatment options by the time somebody got to see me. And the more I kept looking for other things we could do to support our patients, the more I started looking at other ways to support the immune system in general, because there was no magic medication or prescription or something I could give. Right. And at the time, we just had our second daughter. And so we had a 2-year-old and a baby at home. And I was honestly really scared that my husband or I would get COVID and then not be able to treat it. And so we were looking at other ways to support our own health so we didn't get sick. And that ended up leading me to functional medicine, which is all more root cause approaches.
So for our audience who may not be aware, as an ICU doctor, as a surgeon who also works in the ICU, you are seeing the sickest of the sickest. You are seeing patients that are barely hanging onto life by a thread, if I may add. And you're saying that you're thinking, wait a minute, how did we get here? And can that be prevented? Correct?
Absolutely. Awesome. Absolutely. In the ICU, that was when we were dealing with all the patients on the ventilators. And I really feel like the way to intervene is before they get so sick as to need that. And that's what led me into more prevention approaches. And it's a very different style of medicine, but it makes so much sense.
So you have a fundamental take on this, that your immune health is critical, right? And helps you build resilience. And that is similar to what I've been preaching for our fertility patients, where you have someone who's very young, and the eggs are just not as good, or you have someone in their 20s or early 30s and you barely have good sperm, and what sperm is there is barely moving,
Yeah.
right? So
Yeah.
how can women and men of reproductive age build their immune resilience in this post-COVID world?
Well, I think it's really going back to saying what are the things in the body that have to work well to set the stage for people to be healthy, which is different than going to a doctor when you're sick to be diagnosed with the disease you have, but looking upstream and saying what has to happen right and how do we support those functions so that then hopefully you don't get disease. And if
Awesome.
you lay those groundworks or that foundation, that's going to help stuff like fertility, but it's going to help insulin resistance. It's going to help blood pressure. It's going to help mood. It's going to help cognitive function, because
Yes.
fertility is something that we should all have. If your body's working well, you would expect that nature allows these things to work like they're supposed to. And so if we can
Exactly.
just get the foundations right, then maybe we don't need as many advanced interventions to try to support stuff downstream.
Absolutely. So, I agree with you. In fact, for those who don't know, cognitive health, we're talking about brain health.
Yeah,
And one of my saying is, whatever is good for your brains is good for your gonads. You know,
absolutely. Absolutely. Yeah.
how do you assess and treat inflammation and chronic and metabolic imbalance?
Yeah.
And what patterns have you noticed in patients with chronic illnesses?
Well, a lot of things start with chronic inflammation, and patients can tolerate that for many, many years without necessarily having a complete breakdown of their health. And so then it becomes something that's really easy to dismiss and say, oh, this isn't that important. And it's just like, I could eat a cookie for dinner or after dinner today, and I could do it tomorrow, and I could do it the next day. And I'm not going to be sick in a day or a week or a month, but over time I could be. And and so when we go back upstream and we say, well, where is this inflammation coming from? One of the main triggers for inflammation, or one of the things I think is the most common, is when there's disruption in the gut, in the GI tract, and the microbial balance in the GI tract. Because
I
the GI tract is really where your body interacts with the outside world. And that's where you've got about 70% of your immune system. So if there's something wrong and there's inflammation in the GI tract, you've got all your white blood cells and all of your immune system set up right inside that initial mucosal layer to respond to any invading threats or toxins or anything that's being absorbed through that surface area. And
Mhm.
once you've activated the immune system, you're releasing cytokines and inflammatory triggers, and that is circulating all over in your body. So it doesn't just
So
stay in the GI tract.
yeah.
Yep.
So let me just break it down for people who don't know. When you say cytokines, so when your body encounters something it doesn't like
Mm-hmm.
some insult, right? Some
Mm-hmm.
infection, some inflammation, and you're saying in the gut,
Mm-hmm.
it's going to release its own military forces, its
Yep.
own army with its own artillery, and
Yep.
they're going to start shooting rockets every which way,
Yep.
except you're in the line of fire,
Yep.
right?
I
That's
mean,
a
I tell people
simplistic.
when it's food related, I tell people, like, once you have a food that gets from the GI tract into the bloodstream, and then say there's a half digested protein from a cashew nut or from gluten or a dairy protein. Once your
Yeah.
body makes an antibody against that foreign protein, then that antibody can go on to cross react with your own tissues. And so that can become the kind of the initial stage that, I'm sorry, the initial trigger that set the stage for autoimmune conditions. And when we
Awesome.
think of women who have such high rates of autoimmunity, and it just keeps getting more and more and more, that got
Yes.
triggered somehow. And very frequently, I think that's from disruptions in the GI tract, even in
Yeah,
patients
yeah,
who don't have GI symptoms.
exactly. And there are even some literature looking at the gut gonad axis, the
Mm-hmm.
gut brain axis. You
Mm-hmm.
know, your gut is your bowel, your anus is close to your vaginal tract and everything, but it can also get through the lymph system.
Mm-hmm.
Um, you've trained in the Bresden protocol for reversing cognitive decline,
Yeah.
and we know that that could be inflammation in the brain.
Yep.
There is now evidence that there could be also inflammation in the hypothalamus, and that can cross-react with the pituitary axis,
Yep.
which cross-reacts to the ovary and the gonad. So there may be some link there.
Yep.
So can addressing brain fog and autonomic dysfunction help hormonal regulation in the HPA, the hypothalamic pituitary ovarian or gonad axis, and
Absolutely.
help with cycle regularity in some of these patients?
Absolutely. I mean, we know when you're talking about cycle regularity and you talk about PCOS or I'm sorry, polycystic ovarian syndrome, that is extreme irregularity and cyst formation. And that gets worse with stress and that gets worse with insulin resistance. And they sort of feed back and forth. And they're also tied to cortisol. And cortisol has some negative impacts on the brain, which is going to trigger more brain fog reactions and feeds back into the adrenal glands. And so I think in conventional medicine, we spend a lot of time trying to subdivide medicine and say, well, this is my specialty. And then I'm going to go into this really deep training for years and years in this one area. And we just continually subdivide things. And the body just doesn't work like that. Like your GI tract is plugged into everything else and your brain is all plugged into everything else and it talks to each other and back and forth continually. And so that interconnectedness, I think sometimes we miss in the super specialization of conventional medicine.
Excellent. So, how do you use functional labs and genomics to guide, maybe fertility patients, chronic illness patients?
So when I talk with patients, I try to understand a timeline of all of their medical history and significant stressors in their life so that you can understand how did they get to where they are today. Because most people who, like, for example, with infertility, they might be trying to get pregnant when they're 35. But if they're having trouble getting pregnant when they're 35, they probably would have had trouble getting pregnant when they were 30. They just weren't trying then. And so it's not, whatever the triggers are further upstream than the time when it's initially recognized. And so when I talk to patients, I try to get that better history and then get a sense of what were the initial dominoes to fall. And then go back and say, well, let's focus on those early dominoes and see if we can set those up. But anybody who has had any sort of autoimmune conditions, a lot of food sensitivities, history of GI, either infections or GI symptoms, a lot of skin rashes, allergies, migraines. So many of those things can be triggered by the inflammation from an impaired GI tract barrier or an intestinal barrier. And if I'm suspicious of that, you can do some advanced stool testing that looks at the bacterial populations in the GI tract. There's a PCR test, and it's kind of like PCR when we were doing COVID testing. You could check for the genetic material of the COVID virus, except in this stool test, you're looking for the genetic material of about 50 some different organisms. And some are the normal healthy bacteria that you want to find that indicate a healthy gut. Some are clearly pathogens. Some are bacteria where they're okay in small amounts, but when you end up having larger and larger quantities, they can start to contribute to autoimmunity. And so you get a sense of that ecology or that kind of ecological niche in the GI tract. And then it also looks at stuff like digestion and absorption, digestion of your food. And are you pulling all the fat out? Do you have enough pancreatic enzymes? Do we see inflammatory markers? And all of those are things that you can then intervene on because it's data you didn't have. And if I know you've got an overgrowth of candida in the GI tract and that's contributing to leaky gut, I can use some medications or some herbal treatments to address the candida, get that calmed down, get the right kind of nutrients, mostly fibers and prebiotics, to encourage the healthy bacteria to take over and get that kind of that gut barrier sealed up. And there are a lot of people where that has tremendous impacts in their autoimmune conditions, their overall level of inflammation. So that would be a good place to start. But it just
You
depends.
know,
Yeah, go ahead.
yeah, incidentally, because now we're now seeing evidence that endometriosis, which is a very chronic and debilitating inflammatory condition in women
Yeah.
and really curtails fertility, is also highly intimately related to an inflammatory state,
Hmm.
right? So I would encourage all my endometriosis patients to even think about things like this. How can they, what insights can we give them as they're dealing with this very brutal disease?
Well, and we also know when inflammation gets kicked off, inflammation can upregulate aromatase, which then upregulates estrogen production. And so if you're trying to get hormones in balance, but you're overproducing estrogen, then you can start to have some
Side
imbalances set up and then overgrowth of tissues. And so getting that inflammation calmed back down is really helpful. There
Yeah.
are some specialty tests that you can do in some patients that look at the way estrogen is broken down. So in the liver, there's three main enzyme pathways that break estrogen down when you're trying to clear it from the body and have the levels come back down lower. And if you think of those as three doorways, like say you're trying to get out of a crowded theater and there's three doorways, the larger any particular doorway is, the more people are going to exit through that route. And in the same
Exactly.
way, these enzyme pathways, the faster one particular enzyme works, the more of the estrogen is cleared down that route. And so some of those routes lead to metabolites that have a stronger estrogenic effect, and some have a lower estrogenic effect. And the speed of those enzymes is largely genetic, not entirely, but you can look at these breakdown products and say, oh, well, everything's going down doorway number one and not doorway number two. And why don't we make doorway number one open up, or like, why don't we open up doorway number two a little bit? And so there are some other ways you can look at the hormones themselves, but a lot of times it's more foundational than that. It's like, let's look at what you're eating, what foods may be
Yeah.
triggering inflammation, what's going on with stress, like relaxation. Are people sleeping? Because when people don't have that level of foundation, the advanced testing and a bunch of supplements and everything if don't
Yes.
fix the problem if you're just not able to get to sleep at night.
Right.
Um,
Do you, I'm just curious now, do you look at any exposome parameters? Does that come into play? Or you just focus mostly on the genomics? Exposome meaning, a panel of what the whole body is exposed to.
Um, I haven't done exposome specifically. Now, I have done some toxin testing where we're looking for heavy metals and we're looking for toxins from mold or mycotoxins, and then some environmental chemicals. But I wouldn't necessarily say it covers everything. It typically covers a lot. But when
Right,
people
right.
do those tests and it comes back and it says, hey, you have elevated levels of like 15 different things, it's usually not because you have an overwhelming exposure to 15 unique chemicals. It's usually that your general detoxification pathways aren't working that well. So if I do a panel and only one thing lights up and it's like, hey, there's an astronomical amount of lead in your system and where is the lead coming from? Then I want to
Right,
track
right.
that down. But if it's like, where is the 12 different compounds coming
Yeah.
from? Then we got to go back and say, how is detoxification supposed to work?
Yes.
And go
Yes.
upstream from that.
Oh, that's curious. So now you lead groups, you do
Yep.
group visits with
Hmm.
people with chronic inflammation or long COVID symptoms,
Hmm.
persistent post-viral symptoms, and their
Hmm.
effects on. Have you discovered in your group? I don't know what your composition is. Any post-viral effect on their menstrual pattern, their energy, or their fertility?
Well, I haven't seen a lot of, I wouldn't say directly fertility, because most of the patients who are coming to me, if they're coming with long COVID, they're not trying to get pregnant at the same time. But from a fatigue standpoint, definitely. And from a menstrual standpoint, if you look at all of the symptoms of long COVID and then you overlay it against all of the symptoms of perimenopause, they're very similar. And it's not that I think that it's just perimenopause, but I think you could have a woman who's 45 who has, maybe is very early perimenopause and then gets COVID. And then it's like she fast forwarded 3 years into perimenopause, but the trigger was this COVID infection. And so then people think about this as a long COVID case, and hormones can be a part of it. I don't think it's usually not the only part, but when that's a suspicion, sometimes we may start some hormone replacement therapy early if that fits with their symptoms. But I think it's kind of like just aggressive aging. When people have COVID, it's a huge oxidative stress for the body. And if you overwhelm your antioxidant capacity, then you start causing oxidative damage, which is kind of like rusting, or like think of a car that you left out and it starts to rust, or you cut an apple and it starts to turn brown. That's oxidative stress. And if that oxidative damage is happening in the tissues, that's associated with aging of every tissue. And so that's going to apply to the ovaries and the ovarian reserve and the blood vessel walls and the heart and the neurons. And
That's true. And one of the things I warn patients against is smoking and vaping, which we know cause severe oxidative stress, because we know smoking can affect sperm parameters for sure. Now, what would a future healthcare system look like if fully integrated functional medicine principles were included?
Well, I think there needs to be a lot more patient education, because our model is so based on sickness and disease, and like show up to the doctor when you're sick and you just need a diagnosis and a prescription. And that doesn't allow you to intervene early on to prevent those things. And I think that's why we just have more and more and more chronic disease, because we're not focused on prevention. And prevention is not about coming to the doctor for 15 minutes and then leaving and now everything is prevented. It's about patients understanding all of the different levers that they have control over to help support their health and how important those things are. And the truth is that needs to be like a public education type approach. And we just don't have that built into our system. We're always taught you go to the doctor and they're supposed to tell you what to do. And in my medical training, I was always taught patients come to me and I'm supposed to know how to fix them. And neither one of those works, because you need the patient to understand they're in the driver's seat and they have control over the vast majority of things. And the provider can just sort of guide you along. And I think that's a better way to do prevention. If people are, if I'm in a car accident and I come in with a broken leg, well, then no, you don't need to talk to me about treatment. I just want somebody to fix my leg or take me to the OR and operate if that's what I need. But if you want me to regulate my blood sugar, you got to teach me something about blood sugar so I know what to do. And so we need to have that built into our healthcare system, so it's not just disease care.
So, health hygiene. Thank you so much, Dr. Sattah. Where can my audience find? Where can people find you if they're interested and they want to pursue this further?
Yeah. So my practice is in downtown Silver Spring on its Insight Functional Health. And I see people in person here, but I also see people virtually in DC, Maryland, and Virginia. And so you can go to my website. I have a bunch of videos on the website that are geared towards education, because I really believe that a lot of this should just be
Yes.
public knowledge. Like everyone should have access to the information. So you can watch some of the videos there. And then if this approach resonates, then you can schedule a call on the website.
So, ladies and gentlemen, that is Insight, INSIGHT, Insight Functional Medicine.
Insight Functional Health.
Insight Functional Health?
Yep, Insight Functional Health.
Oh,
yeah.
Awesome.
Yeah.
Thank you so much for spending time with us.
Yeah.
And I've really enjoyed this conversation. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.